Why cultural humility matters in mental health. In today's world, conversations about mental health are becoming more open. Yet, for many African Americans, especially Black women, the experience of seeking or providing care still carries layers of complexity. Culture shapes how we understand pain, strength, faith, family, and healing. When those cultural layers are overlooked in therapy, something essential can be lost. That is where cultural humility becomes more than a professional buzzword. It becomes a bridge. For African American mental health professionals, particularly women who often carry both personal and communal responsibility, cultural humility is not just something we practice with clients, it is something we live. Cultural humility versus cultural competence. For years, the field emphasized cultural competence, the idea that clinicians could gain enough knowledge about different cultures to work effectively within them. While knowledge is important, competence alone can unintentionally suggest that culture is something to be mastered. Cultural humility is different. Cultural humility is a lifelong commitment to self-reflection, self-evaluation, and openness. It recognizes that no matter how educated or experienced we are, we do not know everything about someone else's lived experience. It requires curiosity instead of assumption, listening instead of labeling, partnership instead of power. In mental health, that posture changes everything. Why it matters in African American communities. The African American community has a long and complicated history with healthcare systems, from exploitation and medical experimentation to systemic racism and underrepresentation in research and leadership. Trust has not always been earned. Because of this history, many Black individuals approach therapy cautiously. Some have been dismissed. Some have had their spiritual beliefs misunderstood. Others have had their trauma minimized or misinterpreted. Without cultural humility, therapy can feel clinical instead of compassionate. It can feel like being studied rather than supported. Cultural humility acknowledges historical wounds. It validates lived experiences of racism and microaggressions. It respects the role of faith, family structure, language, and community dynamics in the healing process. For Black therapists, practicing cultural humility also means honoring our own identities. We understand, often firsthand, the pressures of being strong, the weight of generational expectations, and the silent resilience passed down through families. Cultural humility invites us to integrate that understanding thoughtfully without projecting our experiences onto others. The impact on the therapeutic relationship. At its core, therapy works because of trust. When clients feel seen beyond stereotypes, they engage more deeply. When therapists approach sessions with curiosity rather than certainty, clients feel safer sharing the parts of themselves that are tender or complex. Cultural humility strengthens the therapeutic alliance by creating space for clients to define their own narratives, encouraging dialogue about identity, race, and systemic stressors, reducing shame around cultural expressions of emotion, validating both pain and resilience. It shifts therapy from fixing problems to walking alongside someone in their healing journey. Cultural humility and professional growth. For African American female mental health professionals between 25 and 45, there is often another layer. Many of us are balancing careers, families, leadership roles, and personal growth. We serve clients while navigating our own experiences of bias or underrepresentation in professional spaces. Cultural humility extends inward. It asks, where are my blind spots? How do my own experiences shape how I interpret others? Am I allowing myself the same compassion I offer my clients? This level of reflection strengthens not only clinical skill, but emotional sustainability. It protects against burnout by grounding practice in authenticity rather than performance. Humility reminds us that growth is ongoing and that we do not have to carry perfection. Practical ways to practice cultural humility. Cultural humility is not abstract, it is practiced daily in small, intentional ways. Ongoing self-reflection, journaling about reactions in session, noticing moments of discomfort, asking what assumptions may be present, active, curious listening, allowing clients to educate you about their worldview, asking open-ended questions about family, faith, community, and identity, continued education, engaging in trainings that center marginalized voices, reading research that reflects diverse populations, community connection, staying connected to cultural spaces, whether faith communities, advocacy groups, or professional networks for Black clinicians. Peer support and accountability, creating safe spaces where clinicians can process experiences honestly and receive feedback without judgment. Cultural humility as leadership. Black women in mental health often serve as bridges in multiple spaces between systems and communities, between faith and psychology, between tradition and innovation. When we embody cultural humility, we model what ethical, compassionate care looks like. We challenge systems that marginalize. We mentor others. We advocate for inclusive policies and representation. Humility is not weakness. It is strength under control. It is the ability to hold expertise and openness at the same time. A call to reflection. Cultural humility is not an optional skill set. It is essential for meaningful mental health care, especially in communities where trust must be cultivated with intention. For African American readers and professionals alike, embracing cultural humility invites healing on both sides of the therapy room. It honors history, it validates identity, it fosters connection, and perhaps most importantly, it reminds us that growth, personally and professionally, is not about having all the answers. It is about remaining open to learning, to listening, and to becoming better stewards of one another's stories. Healing thrives in spaces where humility and expertise meet. And those are the spaces we must continue to create.